it's sort of a combination trash talk and doc talk because it's a little bit of both. So what we're going to talk to you guys about today are...
There's probably people only want to watch our trash talks. This might be a big letdown.
Well, we'll make sure we trash a little.
Okay, all right, I can do that.
We can do that.
I can do that.
It says that COVID-19...
There's your trash right there.
I know. The symptoms...
It's a trash talk.
Yeah. Well, you can't talk about that without there being a little bit of that, right? It says that the symptoms of COVID-19 usually show up in a specific order. And it says that the University of Southern California was able to determine that COVID-19 symptoms often start in a certain order. While the flu begins with a cough, the first symptom of COVID-19 is a fever.
Yeah, you don't know you really have a fever, though.
Yeah.
Fevers can be really mild or really horrendous. It's and that's probably why the kiddies don't complain, because they have chicken pox with a temperature of 102 out running outside like there's nothing going on.
Yeah.
I run a fever of 100. It's like call the morgue, tell them I'm on the way.
Yeah. Well, you know what's interesting? When I had a fever of 101.2, and then it bumped up to 101.7. That's the highest that I had. I honestly... it was a weird deal. So I woke up in the morning and I was freezing to death. And then later I was sweating to death. It was just real random. Yeah. And I think the other thing is, I feel like what I've heard about COVID-19 is that, so here's what it says is the timeline. It says, according to this study, the symptoms in the patients were fever, cough and muscle pain, nausea or vomiting, and diarrhea.
Well, I got the first three all the time.
Yeah.
I got chronic allergies. My body hurts me all the time. What's the first one? Fever?
Fever. Don't have that.
No, probably not. So I got 2 out of 4.
Well, here's another thing. It said
I've had COVID for 25 years now.
Yeah. Well, it says that the flu is usually a triad of symptoms, including back pain, chills, along with a dry cough.
Yeah, and the most interesting about COVID and the flu, and remember this, guys, it doesn't last very long. Okay, we're talking 3, 4, 5 days as a rule. Okay, bacterial infections tend to last longer. They tend to be a little bit more severe when you get them. So people with COVID and flu, they have a cough. People with pneumonia, they're coughing up their lungs. Mm-hmm. So, yeah, so you have to kind of gauge that. And that's how we physicians and healthcare providers kind of tell the difference. A lot of times you might go to the doctor and the doctor says, well, you got a virus, you're just going to have to kind of get over it. But and I've said that to him too. And I'm like, well, if you're not better in 3 or 4 days, give me a holler. But if you are, it's a virus and it'll run its course. And that's all we can really do with them. There's no real magic bullet for viruses these days. Mm-hmm. Oh, there's a flu shot, which really doesn't work. Never really has. There's some other medicines you can take that are quite expensive to lower your symptoms for a day. And so, I don't know. But most importantly, the symptoms for viruses and stuff are relatively, I don't say they're mild, but they're not super severe. But if you had a pneumonia, like a strep pneumonia or something like that, you don't have a fever of 101, you have a fever of 103. It's severe. And so we really have to look at those symptoms. And the other key thing between a bacterial and viral illness is the pulse. Mm-hmm. Typically with pneumonias, the pulse is very high. And I'm talking 120, 130 beats a minute. They're sick. And the reason why is pneumonia is actually a tissue infection. So you're seeding your bloodstream with bacteria, which ramps up your pulse. It's vasodilating your arteries, and your body's trying to compensate for it. Viruses typically don't do that. Viruses typically maintain a normal pulse. Just got a fever. Mm-hmm. It's just an inflammation is what it is. But that pneumonia and different, bacterial infections, they're usually way more severe than viruses are.
Yeah. The one other thing I'll say that I feel like has been the case that...
When do they lose their taste and smell? Does it say that in there?
It doesn't. It doesn't.
A lame article.
Yeah. Well, at least I don't think it said it. It doesn't show it.
That stuff's really pronounced. These people are like nothing.
Well, and not everybody seems to lose their sense of smell and taste.
Well, no, but when they do, it's pronounced.
Well, see, whenever I lost my sense of taste, I didn't 100% lose it. It just felt like things didn't taste right. Mm-hmm. Like, and Dave's daughter, Hannah, she had it, and she when she brushed her teeth, she said the mint tasted funny. And then whenever I got it,
metallic.
Honestly, I don't know how to describe it, but whenever I would use mouthwash and brush my teeth, it just tasted wrong. It didn't taste it right. Like it did sort of taste like toothpaste, but also not. And then whenever I would eat, things just tasted off. Like it just didn't taste like it normally tasted. But it wasn't like I couldn't taste anything. Does that make any sense?
Need more pepper on your poppycock.
Yeah. And the fatigue lasted. That was the thing too for me, and what I've noticed for a lot of people, it seems like fatigue hangs around for a while.
You didn't get that, did you?
I did not.
Pepper on my poppycock.
I did not. I'm guessing that's a reference from like the 50s or something.
No, that's when Harry met Sally, Billy Crystal.
Oh, you know what? I only saw it maybe one time.
Oh, wait there. I need more pepper.
Pepper in my
poppycock.
Yeah, I did. So there's that.
Yeah.
Well,
I love that movie.
yeah, I literally only saw it once.
Oh, wow.
I know, and it was a real long time ago, so I don't remember it. I watched it because I felt like it was a cultural reference I needed to have.
I just love Billy Crystal. I think that guy's so
He's
odd.
and so is what's her name? Meg
Meg
Ryan.
She's a little bit odd, too.
They're both, but everybody's a little odd. We're all
I can
a
relate to him,
little
though.
odd. I think Billy Crystal is the entertainer. Entertainer.
Whatever that is.
Anyway, all right. Well, there's our.
Not much about trash talk, but it was good talk.
But we did talk about Billy Crystal, and you know what? That's a win.
That's a win. That's a home run there.
Mm-hmm. All right, everybody.
Oh, wait there. I need some more pepper on my poppycock.
All right. Well, there you have it, everybody.
Have a good Tuesday.
Have a good Tuesday, and we'll see you Friday for Free Advice Friday.